Intestines. And the small intestine is the major organ of both digestion and absorption. It's about 2 to 4 meters long, which works out to 7 to 13 feet. Runs from the pyloric sphincter to the ileocecal valve, and at that point it joins with the large intestines. It has a small diameter, 2.5 to 4 centimeters, which is why it's referred to as the small intestines. It's actually much longer than the large intestines. It's divided into 3 major regions: the duodenum, the jejunum, and the ileum. The duodenum is mostly retroperitoneal. It's about 10 inches long, curves around the head of the pancreas, and this is where most of the features will be found. This is where most of the digestive process will begin and a lot of the absorption, but it's by no means the only important part. The jejunum is about 8 feet long. It's attached posteriorly by mesentery, and then as we approach the large intestines, we come to the ileum, which is about 12 feet long, attached posterior by mesentery, and joins the large intestines at the ileocecal valve. The cecum is going to be the first part of the large intestine, so ileocecal is that junction. Here we see it mapped out on artist rendering. And the other organs around it, the jejunum part. It gets its blood supply from the superior mesenteric artery. Its veins carrying nutrient-rich blood are going to drain into the superior mesenteric veins and then into the hepatic portal vein and then into the liver. Its nerve supply includes parasympathetic innervation by the vagus nerve and sympathetic innervation by the thoracic splanchnic nerves. There are some structural modifications to the small intestine that improve its absorption ability. Its surface area is increased to be ultimately approximately the size of a tennis court, using circular folds, villi, and microvilli. Those circular folds are permanent folds. They're about a centimeter deep. They force chyme to slowly spiral through the lumen, and that allows more time for nutrient absorption. There are finger-like projections of mucosa, about 1 millimeter high, and they have a core that contains a dense capillary bed and lymphatic capillary bed called a lacteal, used for absorption. And then on the surface of those villi, there are also microvilli, which are cytoplasmic extensions of mucosal cells that give it a fuzzy appearance, and this is sometimes referred to as the brush border. And there are some digestive enzymes there bound to that border, and those are referred to as brush border enzymes. They are used for the final carbohydrate, turning carbohydrates into monosaccharides, small carbohydrates, and protein digestion, which changes it from polymers of amino acids to very short polymers of amino acids. And here is a microscopic view of that, and again, you should check out figures 23.31 for a better look at these. This gives you a really good idea of the microvilli. So these red structures are villi, and then on top of those villi are microvilli. And that, again, increases surface area, and surface area is important for absorption. There are also modifications of the mucosa and submucosa that reflect its function in digestion. There are intestinal crypts, which are tubular glands that are scattered between those villi. There are 5 main types of cells found in the villi and the crypts. First are the enterocytes, which make up the bulk of that epithelium. They are simple columnar absorptive cells. They are bound by tight junctions and have a lot of microvilli. Their function, the villi absorb nutrients and electrolytes, and the crypts are going to produce intestinal juices, which is a watery mixture of mucus that acts as a carrier fluid for chyme. Goblet cells are found there. Those are mucus secreting cells. We've seen them before, found in epithelium. Enteroendocrine cells are a source of enterogastrones, things like CCK and secretin that we touched on before. They're found scattered in the villi, a few in the crypts. There are Paneth cells, which are found deep in the crypts. They are specialized secretory cells that fortify the intestine's defenses. They secrete antimicrobial agents, such as defensins and lysozyme, that destroy bacteria. And there are also stem cells that will continuously divide to produce the other types of cells. The villus epithelium is renewed approximately every 2 to 4 days. Mucosal-associated lymph tissue protects the intestines against microorganisms, and that would include the individual lymphoid follicles, the Peyer's patches, which are aggregated lymphoid nodules, more correctly called that. They're located in the lamina propria, and we find their greatest numbers in the distal part of the small intestines, where the bacterial numbers are going to increase as we approach the large intestine. Lamina propria also contains a large amount of plasma cells, and those plasma cells are secreting IgA antibody, our secretory antibody. Submucosa is going to consist of areolar tissue. There are duodenal glands of the duodenum that secrete an alkaline mucus to neutralize the acidity of the chyme that is coming in. Chemotherapy does target rapidly dividing cells. It's one of the hallmarks of cancer cells. Unfortunately, it's not specific to cancer cells. It will attack all rapidly dividing cells, and cells in the GI tract are rapidly dividing. So many chemotherapeutic agents will affect patients undergoing chemotherapy and with things like nausea, vomiting, and diarrhea. The intestinal juice, we make about 1 to 2 liters daily in response to distension or irritation of the mucus. It is a major stimulus for its production is hypertonic or acidic chyme. It is a slightly alkaline isotonic with blood plasma, mostly water, but also mucus, and that mucus is secreted by duodenal glands and goblet cells. Chyme from the stomach contains partially digested carbohydrates and proteins and undigested fat. It takes about 3 to 6 hours in the small intestine to absorb all the nutrients and most of the water. The sources of enzymes for digestion, bile, bicarbonate, digestive enzymes that are not brush border enzymes, come in from the liver and pancreas. The brush border enzymes are bound to the plasma membranes and perform that final digestion of chyme, the substances within the chyme. Chyme entering the duodenum is usually hypertonic, and therefore chyme delivery has to be slow to prevent the osmotic loss of water from the blood. The low pH of chyme has to be adjusted upwards. Chyme has to be mixed with bile and pancreatic juice in order for digestion to continue. The enterogastric reflex and the entergastrones control the movement of food into the duodenum to prevent it from being overwhelmed. And after a meal, segmentation is occurring in most of the small intestines. That's initiated by intrinsic pacemaker cells. That's going to mix and move a little bit of the contents toward the ileocecal valve. Its intensity is going to be altered by long and short reflexes as well as hormones. And in general, parasympathetic increases motility and sympathetic decreases motility. Between meals, peristalsis is going to be the main moving force. It's going to increase. It's be initiated by a rise in the hormone motilin in late intestinal phase every 90 120 minutes. Each wave will start distal to a previous wave, and that is known as the migrating motor complex, or MMC. Meal remnants, bacteria, and debris would then be moved toward the large intestines, and that complete trip from duodenum to ileum takes approximately 2 hours. So again, peristalsis, primarily moving things forward. Segmentation is going to allow for mixing as well as movement forward. The ileocecal sphincter relaxes and admits chyme into the large intestine, under the control of the gastroileal reflex, which enhances the force of segmentation in the ileum, and gastrin increases the motility of the ileum. The ileocecal valve will close when the chyme starts to exert a backward pressure, and that prevents regurgitation of material that's in the large intestines going back into the small intestines. So increased gastric motility and emptying would have an increased motility in the ileum, a relaxation of the ileocecal valve, and that's under the control of the gastroileal reflex. Both long, it's a long neural reflex and gastrin release. They have the same effect. Distension in the small intestines and reduced intestinal volume or fasting is under the control of long and short neural reflexes, and motilin would initiate long and short neural reflexes. So here we go from our mouth, pharynx, esophagus, down to the stomach. From the stomach, we go through the small intestines until we get to from the duodenum, the jejunum, the ileum, and then into the large intestines. And I will pause there and come back in a moment with the large intestines.